For centuries, the power of the mind to influence the body has captivated healers and scientists alike, sparking curiosity and debate across generations. We've all heard anecdotes of miraculous recoveries, seemingly defying medical explanation, leaving doctors and patients in awe. These stories often hint at a mysterious force, a hidden potential within us to heal ourselves, a power that science is only beginning to understand. This is where the placebo effect enters the stage. A phenomenon as fascinating as it is perplexing, challenging our conventional views on treatment. It challenges our understanding of medicine and raises profound questions about the relationship between our minds and bodies and how they interact. Can a simple belief in a treatment, even a fake one, truly trigger the body's own healing mechanisms? The implications are profound. The answer increasingly seems to be a resounding yes, supported by a growing body of research. The placebo effect is not merely wishful thinking or a figment of our imaginations. It's a real, measurable phenomenon. It's a demonstrable biological phenomenon, observable and measurable in scientific studies, showing real changes in the brain and body. Researchers have found that placebos can have a real impact on a range of conditions from pain and depression to Parkinson's disease and irritable bowel syndrome, offering new hope. Understanding the placebo effect, therefore, is not just an academic exercise. It holds immense potential for revolutionizing how we approach healthcare and harnessing the power of the mind in healing, opening new frontiers in medicine. A placebo, in its simplest form, is a fake treatment designed to appear identical to a real one. It is often used in clinical trials to test the efficacy of new treatments. It might be a sugar pill, a saline injection, or even a harmless procedure, or even a sham surgery that mimics the real thing. The key element is that the placebo itself contains no active ingredients intended to directly address the condition being treated. It is essentially a psychological tool. Yet despite their inert nature, placebos can elicit very real physiological and psychological changes in patients. The effects of placebos are not merely subjective or imagined. Studies have shown measurable changes in brain activity, hormone levels, and even immune responses following placebo administration, indicating a tangible impact on the body. These changes often mirror those seen with active medications, highlighting the profound influence our beliefs and expectations can have on our physical well-being and overall health. This is not to say that the placebo effect negates the need for real medicine or treatments. Serious conditions require evidence-based treatments that are proven to work. However, understanding the placebo effect can help us optimize those treatments, enhance their effectiveness, and potentially reduce our reliance on medications with unwanted side effects, leading to better patient outcomes. The use of placebos dates back centuries, with their roots deeply embedded in the history of medicine. Before the advent of modern medicine, healers often relied on rituals, charms, and inert substances to treat their patients. These methods were believed to harness mystical powers or divine intervention. While some of these practices may have held symbolic value or provided comfort, their effectiveness was likely largely due to the placebo effect. The belief in the treatment's power often played a crucial role in the patient's perceived improvement. The scientific study of placebos began in earnest in the 20th century, marking a significant shift from anecdotal evidence to systematic investigation. During World War II, anesthesiologist Henry Beecher observed that soldiers with severe injuries often experienced significant pain relief from saline injections when morphine was scarce. This was a pivotal moment in understanding the placebo effect. This observation sparked a wave of research into the placebo effect, leading to its formal recognition as a scientific phenomenon. Researchers began to explore the psychological and physiological mechanisms behind this intriguing effect. Today, placebos are an integral part of clinical trials, serving as a benchmark to measure the efficacy of new treatments. By comparing a new treatment to a placebo, researchers can determine whether the treatment's effects are truly due to its active ingredients or simply the power of suggestion. This helps in distinguishing genuine therapeutic benefits from psychological influences. This rigorous approach ensures the development of safe and effective medications, ultimately benefiting patients and advancing medical science. How can a belief in a treatment, even a fake one, translate into tangible physiological changes? The answer lies in the intricate workings of our brains. When we expect a treatment to work, our brains release a cascade of neurochemicals that can influence our perception of pain, mood, and even our immune response. One key player in the placebo effect is dopamine, a neurotransmitter associated with reward and motivation. Studies have shown that the expectation of pain relief, for example, can trigger the release of dopamine in the brain, leading to a reduction in pain signals. Endorphins, the body's natural painkillers, are also involved in the placebo response. These morphine-like substances are released in response to pain, stress, and even positive expectations, contributing to pain relief and a sense of well-being. The placebo effect highlights the remarkable ability of our brains to modulate our physical experiences based on our beliefs and expectations. Section 5 Proof in the pill placebo. Effects in pain management, mood disorders, and beyond. The placebo effect is not limited to subjective experiences like pain relief. Studies have demonstrated its impact on a wide range of conditions, providing compelling evidence for the mind's role in healing. In the realm of pain management, placebos have consistently been shown to reduce pain intensity and improve quality of life for patients with chronic pain conditions like back pain, arthritis, and migraines. These findings suggest that harnessing the placebo effect could offer a valuable adjunct to traditional pain management strategies. The placebo effect also extends to mental health. Clinical trials have shown that placebo pills, when administered with empathy and positive suggestion, can alleviate symptoms of depression and anxiety in some patients. These findings highlight the importance of the therapeutic relationship and the power of hope in mental health treatment. Section 6. The Ethics of Expectation, Navigating the Morality of Placebo Use. The use of placebos in clinical practice raises important ethical considerations. The central issue revolves around deception. Is it ever justifiable for a doctor to prescribe a treatment they know to be inert, even if it might benefit the patient? The traditional view argues that informed consent is paramount. Patients have the right to know what treatment they're receiving and to make informed decisions about their health care. Deceiving patients, even with the intention of helping them, undermines trust and autonomy. However, some argue that a rigid adherence to informed consent may not always be in the patient's best interest. They argue that in certain situations, such as when a patient has a strong belief in a placebo's effectiveness, prescribing a placebo openly could still provide benefit without resorting to deception. Section 7. Open-label placebos, transparency and the power of suggestion. The concept of open-label placebos, where patients are aware they are receiving a placebo, presents an intriguing alternative. While seemingly paradoxical, studies have shown that even when patients know they are taking a placebo, they can still experience beneficial effects. This suggests that the power of the placebo effect lies not solely in deception, but also in the rituals of treatment, the patient-provider relationship, and the activation of positive expectations. Open-label placebos offer a way to harness these elements ethically and transparently. Further research is needed to fully understand the mechanisms and implications of open-label placebos. However, they represent a promising avenue for integrating the power of the mind-body connection into mainstream medicine in an ethical and patient-centered way. Section 8. The mind-body connection, a complex interplay in healing. The placebo effect serves as a powerful reminder that the mind and body are not separate entities, but rather intricately interconnected parts of a whole. Our thoughts, beliefs, and expectations can have a profound impact on our physical health and well-being. This understanding has far-reaching implications for healthcare. It suggests that effective treatment involves addressing not only the physical symptoms of disease, but also the psychological and social factors that contribute to illness and recovery. By embracing a holistic approach to healthcare, one that recognizes the importance of the mind-body connection, we can empower patients to become active participants in their own healing journeys. Section 9. Beyond Belief, Harnessing the Power of the Mind for Well-Being. The placebo effect is not a magical cure-all. It does not negate the need for evidence-based medicine or diminish the suffering caused by serious illnesses. However, it offers a tantalizing glimpse into the untapped potential of the human mind to influence our physical health. By continuing to unravel the mysteries of the placebo effect, we can learn how to harness its power to improve patient care, enhance treatment outcomes, and cultivate a more holistic and compassionate approach to medicine. The journey into the science of mind over body is just beginning, and its discoveries hold the promise of transforming